we've helped over 300,000 people. Most of our providers and most of our patients our users are in the US. And so we've already made a big dent. What's happening is this is dysregulation or a miscommunication between the gut and the brain. And so that can, it's a bi-directional relationship, the gut-brain axis, where how you think can affect how you feel and how you feel can affect how you think. And so what happens and what's thought to happen is there is what's called visceral hypersensitivity. So that's one of the core mechanisms underlying irritable bowel syndrome, where in the viscera around the gut, the nerves are like overly sensitive. And so they're sending false alarms to the brain saying, hey, something is wrong. The brain then is saying, okay, I get it, diarrhea, constipation, and pain, but there is no damage occurring. How uncertain it is to have one of these disorders of gut-brain interaction. Like, it is so common for someone with IBS. Like, they are, one provider told us, like, they hoped, like the patient hoped it was colon cancer because at least then they would know. And I think patients with a lot of these functional gut symptoms like really experience uncertainty and trial and error and are desperate for something. And that's why it is so frustrating for certain, gastroenterologists and GI providers, because there aren't that many good solutions and they are looking to help. And I think just how much they care about the diagnosis, like even often more than the treatment, they just want this, like knowing what it is, because it's so variable and is so, personal. We want to expand, and we are expanding Nerva from just IBS to all GI conditions, especially like disorders of gut-brain interaction, and making Nerva this, like, you have a functional gut patient, Nerva. And so really just end to end, and then leveraging AI in a way that personalizes it in a safe way, but creates that like magical experience for patients where it's for their symptoms, for their goals, across the entire experience, across all of these like indications.
Alex Noumidis, co-founder and CEO of Nerva. I want to welcome you to the Scope Forward show. It's been a while since I've wanted to have this conversation. I'm eagerly looking forward to what you have to say, particularly about the gut-brain axis and the building of your company and where you think the future of GI is going as far as your world is concerned.
Yeah, thank you for having me, Praveen. Great to be here. Excited to dig in.
Alex, you're joining from Australia. I'm doing this recording from Mumbai, and then we're talking about the future of gastroenterology in the US, and it can't be more fun than this. Alex, let's go back to the basics. Why did this area or this field interest you in the first place? And I'm going to broadly bucket it under the umbrella of gut-brain axis. So why did this field interest you? Why are you here doing what you do?
Yeah, so me and my brother started the company, and originally this was in university. We're both like tech and business backgrounds, and we had created this mobile app to deliver like sort of like Headspace, so wellness product to help people manage different conditions with gut-direct hypnotherapy. But then over time, so I got diagnosed with celiac disease. Mm-hmm. But throughout that journey, there is a lot of overlapping IBS. Throughout that diagnosis journey, like before I went and saw my gastroenterologist, I thought I had IBS. And so I went down that rabbit hole. We were already, familiar with hypnotherapy, but IBS and disorders of gut-brain interaction, functional gut disorders, one of the areas where there is such a strong mind-body link, and where gut-directed hypnotherapy is recommended in the guidelines. There's a huge amount of research supporting it as a therapeutic tool. And so because of my own personal experience and our exposure to this, this modality, we were really interested in like, okay, could we make this accessible? It wasn't, common at that time. It wasn't very commonly, available. I think there is, estimated 400 GI psychologists in the US for, the 40 million Americans with IBS and another 40 with other disorders of gut-brain interaction. And so the strong amount of research, my personal experience, and this lack of access like made it a really compelling area that we just wanted to dig into.
Did it help you? Did you reverse your condition of celiac disease?
It doesn't.
Personal experience? Yeah.
So
you manage it. Yeah.
Exactly. So with celiac, unfortunately, you have to manage it with a strict gluten-free diet, but with the overlapping functional symptoms, absolutely. And so it helped me go through that journey and have really deep empathy for like the patient experience when, if you're following, say, a low FODMAP diet as like, the first line treatment for irritable bowel syndrome, it can be super restrictive, and I have to restrict my diet to feel better. And so it really gives me a lot of empathy for that experience.
You talk a lot about psychophysiology. I see that Nerva wants to be a leader in psychophysiology. Can we get some definitions? What is psychophysiology?
Yeah, so it's a mouthful of a word to say, but essentially it's the study of how the mind can influence the body. So the mind and the brain is, the control center of the body. It's an interesting area of study where, how you think and how you feel can affect how you feel. And we know this, works in very specifically in one of the most well-studied phenomena in the world, which is the placebo effect. Like, this is incredibly well studied, where you can really show it can change, your immune response, your how you think can change your pain response. It has all of these downstream effects on your body, just changing how you think. And so that's the study of that. And we are super at Mindset and at Nerva we're super like interested in like, how do we study that? How do we, publish research on that? And primarily, how do we explore that through the lens of the gut-brain connection, where it is, super strong and there's a huge amount of evidence supporting that connection.
Let's go back to the studies and the evidence. And even before that, how long has it been since you got started?
So we started the company in 2018, and then we launched Nerva, which is a digital care program for irritable bowel syndrome initially, and then expanding into the wider functional gut disorders of gut-brain interaction. And so it's been, since 2019 when we've been growing Nerva and making it accessible for patients with irritable bowel syndrome.
So we're talking about 6-7 years.
Yeah.
And what were the clinical studies around that time? So my guess would be that there were already a lot of clinical studies around the topic, even by then, correct?
Correct. There was one study that our chief medical officer is Dr. Simone Peters, and she, as part of her PhD at Monash University, which is an Australian-based university that developed the low FODMAP diet, she did a randomized controlled trial where they compared the low FODMAP diet to gut-directed hypnotherapy, and then a combination of both of them together. And what her research found was they were equally effective at reducing, gut symptoms. So not just, the stress and anxiety, but the actual gut symptoms. So the gut-directed hypnotherapy was just as effective as the low FODMAP diet, but you didn't need to change what you eat. And so that was a landmark comparison study. But outside of that, there's, dozens of studies from the UK, the US, Australia that supported the gut-brain connection, and more specifically gut-directed hypnotherapy as this very effective treatment modality for IBS.
So if you take out the modality of gut-brain hypnotherapy, and if you take that out, so we have FODMAP diet, what other options do patients typically have?
So most providers now treat IBS as through the lens of a biopsychosocial model of irritable bowel syndrome. And so first line, it's mainly, diagnosis. We're moving towards a diagnosis of inclusion. So historically, it's been a diagnosis of exclusion. Let's, exclude celiac, let's exclude IBD, and then eventually IBS. But now moving towards using the Rome criteria and some of these other more positive diagnoses to get to that answer without having to necessarily do all of that. And then at that point, there is maybe minor lifestyle modifications. So that might be fiber or supplements, peppermint oil. And then after that, most commonly it's treated through a lens of medical management. So that might be antidiarrheals, might be Linzess for constipation. So there's this medication management. The drugs are moderately effective. There's neuromodulators and things like that can be effective as well, but it's not a super effective area, but it can help, especially on these sort of symptom-specific categories. And then there's diet modification, and by far the first line diet modification is the low FODMAP diet. And so there's a certain type of carbohydrate, so FODMAPs, and these FODMAPs ferment in your gut, and that fermentation brings in water, it causes gas, and that can then lead to this, at least hypothesized to lead to activating the visceral hypersensitivity, so the overly sensitive nerves to the gut. And so those are the two other combinations. And then the third is behavioral. So that's now called brain gut behavioral therapy is the latest terminology for it. And that consists of either CBT or gut-directed hypnotherapy as the two main evidence-based approaches for delivering that.
So one would expect that the GI industry or pretty much any other industry that's until now unable to pretty much resolve conditions like IBS, simple, straightforward manner, they're not able to provide answers to patients, would be all over something like this, especially when research supports it. But the reality, as you would know, is quite something else. We're not all over it. Why do you think that is the case?
It takes time. So the latest, the 2021 ACG guidelines recommended brain gut behavioral therapies as a refractory. So it is down the funnel. And then the biggest blocker at that point is there just isn't that many behavioral health providers that can actually deliver this, behavioral thing. So it's a long wait list. They're primarily located in academic medical centers. So although, it's recommended in the latest 2025 quality indicators from the AGA, recommend digital brain gut behavioral therapy specifically, there's just a bit this lack of provider access that meant most gastroenterologists or GI providers just don't really have access to somebody local that they can refer. So then really it's up to digital platforms to deliver that effectively at scale. And so there's been a few throughout history. I know you had Bold Health on, there's Mahana. It's a tough, and the way that, that these markets have shaken out, both of them are no longer active. And so the only accessible, digital brain gut behavioral platform is Nerva. There's obviously these virtual platforms as well that are really good, but, we are entirely digital. And so all of us together are really trying to make this more accessible. We've, us personally, although it is, a journey, we've helped over 300,000 people. Most of our providers and most of our patients our users are in the US. And so we've already made a big dent, but there's tens of millions of more. And to your point, these are frustrating, these patients, and it's frustrating for providers. It's hard to not have a good solution for them, and they take up a lot of time, and, providers are searching for solutions, and Nerva is, we think, one of the best ones.
Just speaking more directly, Alex, so do you think money and payment models, existing reimbursement models, have got something to do with that? Because if I am particularly a private practice GI provider, why would I want to invest time in certain modality where I have no experience for, and then I really can't access the staff and pay their salary and then get reimbursed for it? I'd rather do one more colonoscopy, and it makes more economic sense. Just your comments on that.
There is definitely a lack of widespread coverage for GI psychologists in general. And so I think that can make it more difficult to embed and hire a GI psychologist outside of these academic medical centers. And I think that does make it more difficult for them to adopt it. But I think, many providers, these patients come back, right? So these patients are taking up that time that could be used for scoping new patients. And so I think, they don't like these unbillable time of these questions coming through the portals. They don't necessarily, need, if these patients could be helped in these ways, maybe they don't want to necessarily go through the effort of hiring them and doing that if it's reimbursement isn't certain. But for platforms like Nerva that, are backed by a randomized controlled trial, that are accessible, even if the reimbursement rates aren't there, because it is, digital only, it allows us to charge a price that is very accessible for patients, and it is so very affordable, and it is very easy for them to refer without them having to have a high lift and do all this effort to bill codes and marginal rates. That's where Nerva fits in a way that I think hasn't existed at scale before.
Tell me more about Nerva, Alex. So what does the platform do? How does technology play a role? And you mentioned that you've already served more than 300,000 people or cases. Give us more numbers on that. And what have you learned so far on this journey?
Yeah, so Nerva is a digital brain gut behavioral therapy program that primarily delivers gut-directed hypnotherapy alongside CBT-informed coaching, and then psychoeducation. And so essentially how that works is over 6 weeks, it's a 6-week intervention. There's long-term maintenance afterwards, but the results are durable in the research. Patients or users will get referred by their gastroenterologist or their APP, GI provider. We have a HIPAA-compliant referral form, or we can be added into the EMRs very easily. They then refer it out. We reach out to them automatically. The patient goes through like an intake form where we ask them a series of questions. We then leverage that data to personalize the program for them. And so every day they will get a series of CBT-informed coaching that helps educate on the gut-brain connection. A lot of the work that a gastroenterologist wish they could have time for that they just don't. We do a lot of that education, that psychoeducation. And then they listen to a 15-minute gut-directed hypnotherapy session. And that essentially is just a visualization in an engrossed state of focused attention around gut function. And so it might be in a river where you can control the pace of the river. And essentially what the idea is, and the hypothesized mechanism of action, is that over time, you're training the brain to interpret messages from the gut that are being perceived as danger when there's no damage occurring because it's functional, as normal. And so after 6 weeks, we see 81% of people will have seen a clinically significant improvement in their symptom management within 6 weeks without necessarily doing like strict diet change. We do have some nutrition modules in the app, but it's primarily this behavioral approach. And so providers can easily refer it. They don't have to like do all that extra work. And patients at our RCT, in our randomized controlled trial, at 6 months, those results were maintained at a follow-up.
Let's delve into your favorite aspect of the app. Like you mentioned, like a river, and you can control the flowing of the river. Like so that people listening or watching can actually visualize, like to use Nerva.
You would go through and you do the coaching, you would be asked a series of questions, then given education around like how, your mind and gut work. Maybe imagine the last time you've had butterflies in your stomach. Like that's a great example of how you think can affect how you feel in your gut, and the fight or flight response. And so really building that during the hypnotherapy session. So one of the first ones is called mind gut medicine. And it's a visualization of you at an 18th century pharmacy. And so you would be walking in, you see this glass of glowing liquid. And as you take that off the counter and you drink it, you feel it coating your insides. You feel it numbing and like feel positive warmth throughout your body. And so that visualization alongside like more direct suggestions while you're in this receptive, suggestible state over time changes how, the plasticity changes how your brain perceives messages from your gut. And so this is in the guidelines. It's recommended. We just do it digitally in a way that like scales without necessarily needing a human in the loop because we work with providers so directly. You previously asked around what are some learnings that we had. And I think like looking back where like reimbursement really struggled is like the prescription, digital therapeutic market really tried to go down the top-down approach. Like, let's, get FDA, then we'll get reimbursement. And then eventually what will happen is providers will adopt it. And what we saw was like reimbursement didn't really eventuate. And so it's taken a longer time to eventuate anyway. And because of that, providers just it's been complex. There's no, reimbursement. And then providers are just asked to like prescribe these things in a difficult way and adding work to them. Because we started from a D2C, like, going straight to the user, educating them, there's been several benefits over our contemporaries. One is we've had to build something really good. Because patients choose, with their dollar, we had to like build something that patients love to use. And I think that's one of the interesting learnings from a digital only product is that efficacy is partially adherence. And adherence for most apps is not good. And like we've created something that is super engaging and super adherent in a way that like most products aren't. And programs aren't. And that enables this sort of level of like patient adoption. What that enabled for us though, was leverage the patient. They were having such great outcomes. They would tell their provider. So we started to see organic growth from gastroenterologists, APPs, dietitians, who their patients would come to them and say, Doug, I've had amazing results. This program called Nerva, like you should really like learn about it. Thank you so much, blah, blah, blah. And so then we started to see providers bottoms up refer. And so we don't have to spend all the pharma money of like, door knocking and doing all those things. Like we can just educate these people who are already referring patients to us about how to do it better, how to talk about it, things like that.
Walk us under the hood of Nerva. There's a lot of mention of AI. How are you using AI, and what is the technology that's powering this? And just an aside, even while you were narrating the visualization, it almost seemed like a virtual reality or a VR app. Not VR, right? It's
No,
like
it's just
regular app.
audio,
Yeah.
but it's very similar, right? The idea of like VR is it engrosses you into, you get surrounded by it and you believe it. And so what hypnotherapy is essentially like mind-based VR. You get more engrossed, you're more open to it. And then we use visualizations and your imagery and your own imagination to do what VR can, but without having to ship a headset. And so we originally, Nerva, was pre-AI. And so we built a standardized, very effective digital behavioral solution, but that everyone got the same education and the same content, regardless of like their goals and that. And that worked really well. But what really works is, how do I talk to you about your goals, your symptoms, the things that are important to you that a human provider may also talk about? And so the way, we're still early on that journey, but we currently then take all the information we collect about you. So your goals, your symptoms, your triggers, and we use that to essentially tailor the coaching. So the psychoeducation and the CBT informed coaching, tailoring that to you. So now we're talking about your goals, talking about your symptoms, and that may not necessarily change like the clinical efficacy directly, and in our research, we actually have published research where it does. We see an 8% lift in clinical outcomes at the end of the program. But more importantly, it makes you feel like this program is for you, and that like build a therapeutic alliance like is super powerful. And you see it in I don't know how much you follow like AI psychosis and like, 4.0 and some of these things where people like really connect with ChatGPT and AI in general in a way that is incredible. And this builds this therapeutic alliance. But like those programs aren't therapy. They're not backed by randomized controlled trials. They don't have this structure. They're not a protocol. And so what we're trying to do is like, hey, we have this protocol. We have something that works incredibly well, that's based on the guidelines, that's developed by like clinical experts. How can we then take what AI is really good at, which is this like connection, this tailoring, and this therapeutic alliance, and combine them together to create something that's, better. So, when we don't digital therapeutics as a title has, had not great reception over the past few years. That's why we call it like AI therapeutic. It's a next generation of that.
And when you say you're using AI, are you using one of the LLMs out there, one or more, or like one?
So in production, we use Gemini because we have control over that, but we're constantly iterating and testing. So we have like an internal forge where we are constantly checking and trying prompts in our structure against different LLMs. We always making it better.
Delving into that a little bit, if you're using an LLM such as Gemini, the thing is nowadays, like none of the LLMs are hallucinating as much as they used to, but you can't like really fully rely on the AI to deliver the same outcome like 10,000 times. How are you doing this, and how are you making sure that it is predictable and, in other words, production ready?
One of the things we do is like we narrow where we use it. So we don't use it with the actual therapy itself. We want to, start where it is with, non-therapy coaching that de-risks it to some degree. We have also, because we have this, so many people, so many providers already referring, we don't, want to risk it. And we're taking a very safe approach, iterative approach. So we are being very structured in the prompts. So we don't have a huge amount of like leeway. One of the problems if you have like a chat is that, that opens up the floodgates of like inputs and then potential like hallucinations or things going off script. And so we've been very deliberate in that we like restrict when patients or users can enter free text with the LLMs, because then we can control the input. We know if it's a multi-select question, the amount of possibilities really reduces, and then we're very strict on the prompt and the system prompts and context, and then we use a knowledge base with verified medically accurate information. And so all of those things together means that it's incredibly safe and written a lot less risky than probably a lot of other programs out there. But over time, we hope that we can, further broaden and loosen that up so we can have that. But we want to do it in a safe, strategic way.
Let's talk about the science. What exactly happens in this modality? If you can once again go under the hood, explain in simple terms from a science or a physiology standpoint, how exactly is the mind or the gut recalibrating itself? What must be happening?
There's a few underlying mechanisms of action behind hypnotherapy, but even going back, how does disorders of gut-brain interaction? So that's how they're classified today. But just focusing on irritable bowel syndrome, there's no damage occurring. It's functional. And so what's happening is this is dysregulation or a miscommunication between the gut and the brain. And so that can, it's a bidirectional relationship, the gut-brain axis, where how you think can affect how you feel, and how you feel can affect how you think. And so what happens, and what's thought to happen, is there is what's called visceral hypersensitivity. So that's one of the core mechanisms underlying irritable bowel syndrome, where in the viscera around the gut, the nerves are overly sensitive. And so they're sending false alarms to the brain saying, hey, something is wrong. The brain then is saying, okay, get it, diarrhea, constipation, and pain, but there is no damage occurring. And so this hypersensitivity is what is really driving a lot of those symptoms. And so the way that it's thought to work is hypnotherapy, essentially, or brain gut behavioral therapy, but CBT has a bit different hypothesized mechanisms of action. But hypnotherapy, gut-directed hypnotherapy, is essentially changing how the brain perceives those messages. So these are false alarms, and it's turning down the perception of them. Or another analogy might be, your gut is saying there's a fire, but it's just the smoke alarm is broken. And so we're fixing the smoke alarm. We're changing the alert system from the brain down, versus say something like the low FODMAP diet is just reducing the triggers that irritate this dysregulation or this overly sensitive nerves in the gut. There are other mechanisms. So say changing hypervigilance. So CBT is really great for changing how people are focused on their symptoms, changing how it's affecting their lives. If you're constantly thinking about your gut, you're going to be very aware when there's normal gut sensations, when you're bloated, when there's distension, when you are feeling a little bit of trouble. Someone who is hypervigilant around that is going to experience those symptoms at a higher significance than someone who's not. And so there's a few different mechanisms of actions. There is some evidence talking about gut motility, so changing the speed of which food moves through the gut. It's not exactly sure how that works, but partially, potentially, changes in the fight or flight response. We know how that changes motility and changes blood to the gut. One short digression, but there's this really interesting study that looked at balloons. Essentially, for people with irritable bowel syndrome, you would insert a balloon inside the colon, and you would inflate it. And you compare that to people who didn't have IBS. And what they saw was, for people who didn't have IBS, the inflation would go to 5 centimeters or something. But for people with IBS, it would only go to 3 centimeters or 2 centimeters before they started to feel pain. No damage, but it's, an overreaction to the same stimuli. And then they did a course of hypnotherapy. So, again, visualization inside a focused state of relaxation and absorption. And they would do these visualizations. And then after that, 6-week period, they would do that same study. And they would find that the balloons would inflate to a normal level again. And so that's where it's this visceral hypersensitivity is a core part of that. There's the vagus nerve and how that connects the gut and brain and all of those things. But yeah, that's the high level of it.
I was actually going to get to the vagus nerve. So I'm a yoga practitioner, and let's say the breath related practices have got to do with activating or using the vagus nerve to activate the parasympathetic nervous system. So the sympathetic nervous system is very, very active. Now, how do you settle that down? And if I have to say what you said in my own words, for some of these patients, the sympathetic activity is very, very high. So the flight and fight response is triggered again and again and again, and sometimes unexpectedly, and a lot of these are false alarms. That communication is happening through the vagus nerve. So maybe some of these modalities are trying to settle that communication down and by activating the parasympathetic activity of the same. Am I understanding it correctly?
100%. Yeah. So it's definitely related to the parasympathetic and sympathetic activation and fight or flight response. And often, people are perpetually stuck in a, sort of fight or flight response and activated with food as a trigger or stress as a trigger. And that obviously has, changes in gut function and motility. So yeah, 100%.
So if you go a little bit further, if you go below the surface of why the gut is getting triggered again and again, go into the emotion aspect of it. Either, there are lots of fears. Sometimes these fears are going back maybe several decades. There are certain root patterns that are triggering these fears. And it started at some point of time, they would have typically had a life event, for many of them at least. And also on the other end, if fear is on one end, the other end is anger and rage and that kind of stuff, or suppressed rage. So you're seeing some of these, at least in my experience, that's what I've observed. I would like to validate what your observations have been. And is this also a direction that Nerva goes, or it's beyond the scope of your work?
So is this around how emotions can impact the body, or specifically what do you?
Yeah, exactly. Not just speaking generically about emotions, but certain deep-rooted emotions that tend to repeat. Let's call them inflammatory emotions because they're triggering inflammatory response in the body.
Yeah, so we don't really explore that in Nerva. It's probably, it goes deeper than Nerva does. We don't spend a huge amount of time outside of the hypervigilance, catastrophization, and generally, those CBTGI sort of techniques and psychoeducation. So we do touch on it at a high level and giving them techniques to how to manage their stress and emotions and how that could potentially link to their symptoms. But yeah, I haven't researched that area.
Okay. What kind of clinical studies have you done? What are your studies proving?
Yeah, so originally, Dr. Peters, our chief medical officer, she did her randomized controlled trial comparing 6 weeks of gut-directed hypnotherapy against the low FODMAP diet and found they were comparable. But that's not our study. Since then, we have published several real-world studies. So looking at, one of the advantages that we have as a digital program compared to other mechanisms is that we can run large-scale, real-world studies. And so we've run, I think, with N's over 20,000 with real world studies of how does engagement work? What are the outcomes? Asking interesting questions. I think, we have right now 6 or 7 ongoing studies with massive academic medical centers in the US. We just had some published as well. But probably the primary one and our sort of landmark one is our randomized controlled trial. And so that was run by Monash University, again, the developers of the low FODMAP diet. And they looked at Nerva as it is, as delivering brain gut behavioral therapy against a sham version of Nerva that was still active because it had the psychoeducation, which we know does have some symptom improvement for people with irritable bowel syndrome, but it lacked the gut-directed hypnotherapy component of it. And so what they saw was within 6 weeks, there was 81% of people saw a clinically significant improvement in their symptoms versus 63% in the control group. And then across pain specifically, which is one of the primary signifiers of irritable bowel syndrome on the FDA scale, there was 71% of participants on the Nerva arm saw clinically significant reductions in abdominal pain versus 35% in the control arm, which again is still active. And so both of those results were maintained at a 6-month follow-up, so making sure it's not placebo, it is a durable improvement. And other studies, not our own, have shown that up to 5 years. So, can really have a condensed condensed 6-week intervention that has like long-term impacts. There's also improvements in anxiety and stress and like quality of life alongside those more, gut symptoms as well. And I think that's one of the most like interesting things, as well as like, that they didn't do diet. They were just doing Nerva.
A lot of insights in there, Alex. I'm curious to know, reflecting on your whole journey, reflecting on all of these studies and, these number of patients that you've served already and everything that has gone on since then, at a very personal level and maybe even at a human level, what surprises you?
I think something that I always come back to is how many people with IBS. So there's two things. One is like how uncertain it is to have one of these disorders of gut-brain interaction. Like, it is so common for someone with IBS. Like, they are, one provider told us, like, they hoped, like the patient hoped it was colon cancer, because at least then they would know. And I think patients with a lot of these functional gut symptoms like really experience uncertainty and trial and error and are desperate for something. And that's why it is so frustrating for certain, gastroenterologists and GI providers, because there aren't that many good solutions and they are looking to help. And I think just how much they care about the diagnosis, like even often more than the treatment. They just want this, like, knowing what it is, because it's so variable and is so, personal. And there aren't that many good solutions out there other than, Nerva and Biopsychosocial diet. So that's been surprising. I think, like, why we started this and why, I'm constantly surprised just like how powerful the mind and the brain is, as a, like, surface area for like improving the body. Like, it's, you see people who are like, every time I eat these foods, I feel sick. And like, it's so physical. It's so like, I eat food and I feel sick. And yet with Nerva, you can change that response, and like, you can physically change that. And like, seeing it with the balloon studies and seeing it with like, pain water and seeing it like in immune response and some of that research, like every day I'm surprised and excited by that, like, cool science.
So they'll eat the same food but not get triggered.
Exactly.
Nerva program. Yeah.
Exactly. Yeah. And so like, you have this trigger food for years, and then you can do Nerva, or do, brain gut behavioral therapy generally. And then you can, start eating the foods you love again. And that can be compelling. And as someone, again, I have celiac disease, I have to follow a lifelong, strict gluten-free diet. Like, I would do anything to be able to eat gluten again. And it's quite proud to be able to help people at least like improve their quality of life, change how they like think about food, and like manage their symptoms.
Amazing. Congratulations on all your work and your team too. Let's switch gears to the business side. Let's delve into those aspects. How do you make money?
Yeah, so we charge largely the patient. So it's $199 for 12 months access. So they get the 6-week core intervention, and then they get access for the rest of the year for the maintenance program, which is like a lower touch, more maintenance based on how adherent they were in the 6 weeks. And so that's $199 for consumers. They pay like cash pay. We do have some insurance contracts, and we are working with, GI groups to help them, distribute this to their patients, as well as, in the future, obviously going down reimbursement, whether that's through Medicare or through employers and health plans. Like, this eventually, the goal would this be like a reimbursed program that is free for patients. If you are referred by a provider, you get a 25% discount. So that is $150. And for most patients, that is, completely affordable. And so, yeah, that's largely how we've grown today, through providers and D2C.
What you're narrating, is it just for the US market, or doesn't matter which part of the world?
That was, the US market. So like, it's differently priced, like largely just based on currency conversion. So like in Australia, it's $249. In the UK, it's can't remember the UK price. But yeah, so
yeah, no, I get it. Like, so it doesn't matter in which part of the world the patient is or the provider is. They can download Nerva from the App Store, start using it, and then they pay for it, and that's how it would work. Am I understanding?
Exactly. So they would go, they'll go on the platform. We have Nerva, the companion app, but they can, get started on the web. They get referred by their provider, whether that's, we have an online HIPAA compliant referral form, or otherwise the patient can self-start, and then they can go through that journey.
Do they talk to a human being on your end at all, or it's not needed?
Not right now. We are thinking about what that could look like to help level up. I know a lot of patients would like to have someone they can ask those questions to. We do use AI to help a lot with that, but exploring how a human in the loop could help augment that. But generally, because we do work with providers so heavily, and we want Nerva to be helping them, and they have a relationship with us, we can leverage them to augment that care. So, we send back reports about, did the patient start? Here's their symptoms. They can provide us little personalization notes. We then send back adherence data. If they want to use it, if they don't, but it'll go straight into their chart. And so we leverage the provider themselves as that human in the loop that other platforms might have.
Why did you choose to have a booth at ECG? Why are you trying to get the attention of the GI community? What do you want to do with the GI providers? What's in it for them? What's in it for you?
Yeah, so we work with many GI providers. So I think, we've had actively, we have several thousand providers referring Nerva every month. Many gastroenterologists, APPs refer Nerva. There's just, as you discussed, there's an unmet need in these functional gut symptoms. They want to help their patients. These patients can be, can often come back. Often there's not a lot of good solutions. They're struggling, they're desperate. And so providers have this intrinsic need to I want to help my patients. I don't have access to a GI psychologist. I want to send them something. I want them to leave with a plan that they could take. And so we offer them that. So it's really just a, partnership where they can refer their patients feel great. They get the benefit of that, both on the brand because they referred it, but also then they can use that time for seeing new patients, reduce some of that pressure on their capacity. And so that's why we're at ACG. We go to all of the big conferences. We present a lot of research. So a lot of our research is at DDW or ACG. We engage with a lot of the key opinion leaders in the space, like Bill Che, Lin Chang, many other amazing people that are really caring about and see the value of the brain-gut connection and how important brain-gut behavioral therapies are in making this, helping those patients. And so, yeah, we're deeply embedded in that system. We also work with a lot of these institutions to do research, whether it's, Mount Sinai or Mayo or Stanford. We're doing research across the board, and, we want to work with them at those places to see it come to fruition.
Do you integrate, there are reports or anything of the sort? So do you integrate with existing EHRs? Do you build? Okay.
So we have a very low lift mechanism to be added to their EHRs. And so whether it's, Epic is a little bit, we have to get IT approval, but for many of these, it's really a 5-minute job, and any providers can do it themselves, or the IT support or admin support can do it too. And so either you can, we have an online form on our website. It's literally just the patient's name and email address, and it's all HIPAA compliant. Or they can adding us to their EHR, and then it's a one-click referral to us.
Tell me about your team. So you have a team in New York, team in Melbourne. More than numbers, I'm interested in what constitutes your team that's creating this amazing stuff.
Yeah, so we have an amazing team split, mostly product and clinical are based here. And then we have partnerships in the US. So we have a New York office, and their whole job as clinical specialists is to meet with providers, talk about the program, answer any questions they have, help unblock them if they're experiencing difficulties in diagnosing patients with DGBIs can be frustrating. And so that's sort of how we split it. And internally, as we spoke earlier, I started this with my brother. We've been building this together for a long time. We have an amazing team of our CTO was CTO of a $2 billion company and did 5 years postgrad in AI. We have clinicians in the team. So a lot of our provider clinical specialists are dietitians and GI dietitians who referred Nerva and then joined us to come help make it accessible. And then, obviously a lot of technologists, engineers, product builders. Our head of product is also a dietitian as well. So we have a deep like knowledge base of like GI as well as like lived experience with these conditions.
Have you fundraised?
Yeah, so we've raised $19 million to date. We went through Y Combinator, most of, mix of US, Australian investors who helped supporting our mission.
Why are they buying into the story? I know the answer, but from entrepreneurs in the audience listening in, what is it that the investor community is seeing in this modality, in your focus on gastroenterology and psychophysiology, if I may say?
Yeah, I think it depends on each investor, but I think the common through line is like we have created something that is very effective in a really interesting way that like if what does this look like at scale when in the next 10 years you have like what does it look like when these are first line interventions where you can leverage the mind to improve the body's health across these indications? Like that's a big a big vision. We have the data, we have the research, we've published it takes several years to publish a randomized controlled trial, and so the big vision and the evidence to prove it, I think like that is all it really takes. Then we've done something that's really hard. Like it is really hard to build a distribution, build like relationship and a network of providers that believe in what you do and want to refer it to their patients. Like that's a high bar of trust that they have, and it takes time. And we've done better than probably any other company in this like digital care program space. And that's because there is such a pain point. We have spent all this time building the evidence. We have created something that patients love, and then they love their providers as well. And that's hard to do, and they value that.
Any advice you have for Alex to entrepreneurs or people who want to start up and they want to be in your shoes and they're thinking, okay, I like what he's doing. He's disrupting the space in a very positive way. How do I do that?
The biggest thing that I see as a failure mode for people who are wanting to be entrepreneurs or founders is like delaying it. There's always a reason to not do it. There's always a risk. And like we were easy because we started this in university. And so we didn't have as much, families and stuff like that. But there's always a reason. Like I need to do more of this. I need to spend more time doing this. I think like just do it, like get started, having that bias to action. We entered this space, I am not a clinician. Like I have lived experience with as a patient, but I have to learn so much. And I'm from Australia. And so I have to learn so much about another healthcare system. And I think like if you had to wait until you learned all those things, like it would have moved past you, and like it's infinite. So you have to just start and then be open to like learning from like people that have that experience, but also willing to break with tradition, because like outsiders often do the best at disrupting or thinking about a industry differently than people who are so embedded day to day. And so make that your superpower.
What's the future of Nerva? If you have to think in an unrestrained manner, you have all the money, all the technology, all the types of resources. What would the future of Nerva be?
We want to expand, and we are expanding Nerva from just IBS to all GI conditions, especially like disorders of gut-brain interaction, and making Nerva this like you have a functional gut patient, Nerva. And so really just end to end, and then leveraging AI in a way that personalizes it in a safe way, but creates that like magical experience for patients where it's for their symptoms, for their goals across the entire experience, across all of these like indications. And then really making Nerva, like our dream is like we want Nerva to be like a first line intervention that's in the guidelines, that every you go to your primary care, you go to your gastroenterologist, you get referred Nerva first, because it is low risk, there is no side effects, it is available from home, it's durable, it's time bound, like it just makes sense, and then you want it reimbursed. And so going down to employers and to health plans and making the case that look, this is substantially these patients are ending up in ERs with unexplained abdominal pain, they are going to expensive just GI psychs that are costing money, and that are really doing amazing work. Like we can offer that at scale more affordably and have like an incredible ROI. And so I imagine you go to your doctor, you get referred Nerva, you have one of these conditions, you get referred Nerva, it's covered by insurance, you have an amazing experience, it's so perfectly tailored to you and your things. And after 6 weeks, you just feel great again and you can go about living your life. And then, across the US, across the world, like we hope that's our vision.
Let's reflect for a moment beyond Nerva. What is the future of gastroenterology, of healthcare? if everything that you imagine were to become possible because of AI, because of shifts in our understanding of science and the human body?
It's a big question, a lot of excitement. I think specifically in GI, and I think it's common across the board, like moving towards like outcome-based care. Like we've been talking about it for a long time, but I just don't see with the ballooning costs and better technology. And you saw like there was the like latest changes with like talking about value-based care. Like, I think it just makes sense that care more and more will be like evaluated based on how effective it is, and like priced in that way. Like, why does it matter if it takes one visit or 6 visits or, an app to produce those outcomes if those outcomes are so like powerful? And I think as technology improves and as AI takes a more of a center place outside of just like the clinical operations and like the admin side to like enhancing and delivering like care at a more efficient scale, like I think the only way to value that is based around like the outcomes that it drives. And it's probably a journey and it's going to take a long time, but I think that could have like a massive opportunity to have more efficient, higher touch, better care in a way that like is difficult when it's just fee for service regardless of quality.
Is there anything else that you wanted to share that we didn't cover?
No, I think, that was great. I got it all out. That was a lot of fun. Thank you so much for having me.
Yeah, no, thank you so much. This was a lot of fun for me too. And it's great to get your insights and to see this area, this field from your lens, somebody actually building it, making it happen. I wish you and your team a lot of luck and great success. Thank you so much for coming on the show.
No worries. Thank you for having me.